Today we will talk once again about our women's health, because you understand very well that it's us women who are the caretakers of our hearth. The appearance of offspring in the family depends on our health, our men's health, and the well-being and comfort that we share with each other depends on our health that's created by you. So naturally, the issues that we are addressing today concern whether we are truly beautiful, young, healthy, or already in middle age and even elderly, who our men always need, and the better you and I look, the healthier we are, the stronger our family ties, and the more prosperous our family is. I always tell any people who study the structure of the female male reproductive system and in general deals with female and male health that first of all it's not the reproductive system of our organs but a social system that allows us to naturally prolong the well-being of our family life, preserving it in its original form when we were young, beautiful, and created this healthy family. I see you have sound, so let's talk about we continue our conference. First of all, if we are talking about women's health, every woman understands perfectly well that the future of our family, a normal birth, a normal conception, a normal pregnancy, depends on the state of our reproductive system in our youth. Therefore, in a natural way, first of all, it's about the formation of correctness. This formation, which ends almost with the maturity of the whole organism, usually between 19 to 21 years old, we should control the correct formation of the genital organs themselves, and naturally, what supports the correct functioning of these organs is the endocrine system, on the action of which our ability depends. This might continue for some women up to 60 years, and for some other women, they end this, that is to say, their main female function, at no more than 40 to 45 years old. For some, menopause begins already at the age of 40. And naturally, we understand that as soon as a woman's hormonal levels change, the woman begins to have problems with the genital organs. In this case, there is a possibility of developing changes in the structure of the ovaries. A turn of polycystic ovaries occurs. Inflammatory processes can lead to the obliteration of the fallopian tubes. And even when there is a desire to give birth to a child after 40 years, and at the same time there are already a bunch of all sorts of diseases, plus inflammatory processes, abortions, which most women do, realizing that all children who are conceived are not born, and we actually control the processes of giving birth to our children, then all this does not have a beneficial effect on our organs. Changes naturally occur in the uterus under the influence of hormonal levels. Very often women experience changes in the lining of the uterus. Nodal changes are observed in the muscular layer of the myometrium. That is, myometrium is the muscular lining of the matrix or uterus, or para or perimetry, more perimetry, parametrium only in the area of the cervix. It passes through the perineal ring. All other parts of the uterus are covered with peritoneum. Subserous nodes and adventitial tissues are rare. Nodes can appear specifically in the area of the isthmus and cervix, which leads to even more almost changes can occur in the ability to conceive, but these abnormalities are less common than in the body and base of the uterus. Naturally, the same hormonal background and inflammation can lead to changes in the uterine lining. Conditions such as endometriosis or uneven growths can occur, especially after an abortion where the endometrium prevents proper and normal function. Sometimes improper restoration of the endometrial growth is the cause of miscarriages. That being said, the health of this organ indicates that our uterus is crucial for carrying a pregnancy. This is because the process of fertilization, fragmentation, and formation of a blastocyst, where cell division occurs and embryonic layers are formed, all begins in the fallopian tubes. If the fallopian tube is passable, everything that is formed enters the uterine cavity. For about 2 days, sometimes up to 2.5 days, this fetal material, which has entered the uterine cavity from the fallopian tube, looks for a point of attachment. This is where the blastocyst should attach. The placenta begins to develop, and that's when pregnancy initiates. Of course, we understand that a woman's primary biological role, determined by nature, depends on the proper function and formation and maintenance of her health. This is pertinent for bearing children, continuing our lineage. Any abnormalities in the ovaries, fallopian tubes, or uterus itself can lead to secondary infertility. These instances are more frequent if incorrect development occurs either during the fetal period or after birth. If an infection is introduced through the genital tract post-birth, then you understand well that the vagina is the entry point for any infection that can penetrate the abdomen. So maintaining women's health from the moment of conception right up to the end days, when there's a decrease in hormone production and almost menopause and the postmenopausal period begins. Here, the lack of female sex hormones leads to rapid aging of our skin. So generally, postmenopause is the time when rapid physical changes begin because of our skin, the correct formation of collagen, elasticity fibers, essentially skin turgor, all is influenced by our sex hormones. So naturally, any woman of any age try to maintain her beauty, youth, and health. We had separate webinars on this topic. There are certainly a lot of feedbacks when the first thing that our users who tried our unique product, Actividan, noticed was its ability to rejuvenate almost the entire body and naturally improve mainly the condition of the skin and its derivatives like nails, eyelashes, eyebrows, our hair, and so on. You understand that there have been more than 2,000 studies conducted on Actividan, and these studies, which are being carried out today, cover many aspects of our lives, including aspects of women's health. I have repeatedly told you that in our departments now, if anyone has ever visited oncology, you'll see young girls ages 14 to 16 suffering from breast cancer, uterine cancer, cervical canal cancer. This is primarily due to the uncontrolled use of contraceptives, which can lead to malfunctions, and the proper formation of cell restoration and poor hygiene, early sexual life, early abortions, and frequent change of partners. No one controls their microflora. They only seek help when discharge begins. There are a lot of young people now, again, ages 14 to 16. Young women of reproductive age from 21 to 45 years old, when they can still bear children, but these women are dying. Why? Because they have neglected their health and come very late for certain diseases when it's already impossible to stop something. The proposed measures are treatment of even the same oncological diseases, regardless of patient's age, be it 14 or 74 years old. You will understand that it's mostly removal of organs, chemotherapy, and radiation exposure, which kills our entire body because it affects all organs and systems without selectivity. Are we getting chemicals injected into our veins, or do we use absorbed forms of drugs that are absorbed through the gastrointestinal tract? Either way, once they enter the blood, they infiltrate all organs and cause changes in absolutely healthy organs, which have virtually no relation to the tumor found in the same reproductive system. The whole body suffers, but without it, practically, we cannot do without it, and the earlier certain changes in the health of a particular organ are identified, especially in women, the greater the likelihood of restoring health, the greater the chance of improving the quality of life for many, many years. Hence, the most important thing is to diagnose in time, and even better to engage in prevention, the development of these diseases. We say that those people who take Actividan, considering themselves healthy, they practically support all the processes of control over the cells of the entire human body. Our Actividan will enhance the processes of apoptosis. In this case, the changed cells die naturally, which is genetically inherent, but it also controls the increase in quantity. And most importantly, the ability, the performance of one's own cells, from which we need to restore the integrity of this organ, and not just integrity, but to form functional units from these cells that will ensure the normal function of dead cells. That is, if we do not restore this, it's all carried out due to the receptor apparatus. Receptors on cell surfaces contribute to the unification of cells into tissues. They exchange information. These same receptors, oriented inside the cell, control the cell's health from within and trigger apoptosis processes. They bind to external receptors, attract macrophages, and most importantly, control the function of intracellular organelles. These organelles must produce substances that are specific to certain cells of any tissue. If we take any organ, including our female reproductive system, we understand that any organ, including our mammary glands, uterus, fallopian tubes, ovaries, and external genitalia, comes to during sexual intercourse when your libido arises. It's not only the male penis that fills with blood. Women experience increased blood flow to the external genitalia, and this blood flow is determined by the state of your vascular bed, which affects nutrient supply and hormone distribution. It's all conducted through the bloodstream, and you realize it depends on the quality state. Our blood's work practically determines our youth, beauty, and health, the ability to bear children, maintain pregnancy, give birth to healthy offspring, and so on. For any organ and system one might consider, we understand that our product, Actividan, is primarily control over the vascular bed of any organ we discuss, including organs in a female reproductive system. It doesn't simply thin the blood. Why? Because first of all, according to numerous studies, Actividan controls processes of maturation, cell blood composition regulation. You probably know that many women, especially after childbirth, experience anemia, but with age, anemia becomes harder to treat. Specifically, age-related changes lead to folate deficiency anemia, which is hard to treat because the gastrointestinal tract doesn't work properly. It doesn't get absorbed there, where there's no production of vitamin K, which is responsible for those processes involving iron and folic acid. Naturally, by supporting the gastrointestinal tract and the state of the blood vessels, we regulate the red bone marrow, kidneys, as they produce the substances that control the functioning of the red bone marrow. Erythropoietin, thrombopoietin, leukopoietin are also produced there. In short, the circulatory system depends on all organ systems, taking into account the number and correct interaction of cells with each other, correct differentiation of these cells that again cannot do without apoptosis. Incorrect apoptosis is a change in blood cells. Women suffer from this. It all affects the reproductive system. Plus, naturally, you understand that the formed elements are suspended in blood plasma. So the ratio of plasma and blood formed elements is one of the reasons for normal functioning or obstacles to the normal functioning of our small vessels in particular, which each cell's nutrition relies on. Very often when the ratio of plasma and formed elements changes, the blood thickens. The ability of leukocytes, for instance, to adhere to the walls naturally changes. They line the walls of blood vessels, and naturally, if the blood is thick, blood clotting factors start to form, resulting in microthrombi or large clots. That is to say, when we use Actividan, bleeding never increases. The blood condition practically stabilizes. The walls of blood vessels are stabilized. Diapedia hemorrhage does not occur, and naturally, there is no danger of bleeding when using Actividan. If we're talking about the female system, this happens very often. Women often ask why, when taking Actividan, if there's some kind of pathology such as fibromatous nodes, myomatous nodes, or endometriosis, and so on. Usually, if there are any changes, bleeding occurs. This is the condition the woman is brought in with. She hasn't been operated on. The myomatous nodes were not removed. There are fibromatous nodes, or they have not been properly treated, but we practically have endometriosis. In no country in the world are there sufficiently effective methods of treatment. All this is temporary, then it all grows again. If it spreads to other organ tissues there, generally speaking, the prognosis is very unfavorable. And so, most often with bleeding, if a woman was admitted and there were changes in the uterus, they went in, they did a curettage, they sent it, then they said, well, let's get some treatment, and then if there are nodes there, come for surgery and we will remove the nodes. After removal of the nodes, naturally the menstrual cycle can be restored if there was menopause. and the age is still such that restoration of menstrual periods is possible, then our Actividan, as you remember, we always talk about this, it has a very good effect on the endocrine system, neuroendocrine regulation when taking Actividan, especially in current doses for a particular pathology. It can lead to the restoration of hormonal levels, to the normal formation of the endometrium. And if the hormones are restored, that is, the hormonal cycle works normally, then the menstrual cycle may appear again. We already have a lot of such patients who had menopause. Menstrual cycle suddenly began, the menstrual cycle was restored, and even there are pregnancies and births. Absolutely healthy offspring. That is, in this case, each patient is individual, but I repeat once again, Actividan itself never causes bleeding during any surgical interventions. After surgery, before surgery, Actividan can be used. For such patients who had gone through menopause, menstrual cycles suddenly began, the menstrual cycle was restored, and there even have been pregnancies and births of completely healthy offspring. Each patient's situation is unique in this case, but I must reiterate that Actividan itself never causes bleeding during any surgical interventions. Before or after surgery, Actividan can be used, unlike our anticoagulants, which we prescribe to our patients, can cause bleeding or even disseminated blood coagulation. Like these, Actividan does not interact with the coagulation system and has this unique feature. I want to reiterate that there are a lot of pathologies in women associated with inflammatory processes, and you understand that inflammation most often occurs due to the presence of viral, fungal, microflora, or certain bacteria. Recently, private laboratories and clinics have become popular. They might identify anything for you. So it's always better to double check, even though it may be expensive. You may take tests in one clinic, look through at another, but it's always advisable to go to a trusted clinic where you know they won't cheat. Many of our doctors collaborate with private clinics and private laboratories to impose expensive drugs on you. They practically send them to specialists who sometimes detect something which is not present at all, so it's better to check by yourself in your own clinic. Let them take it away, test, and confirm. Private clinics often exaggerate the presence of certain pathogenic agents, which will then be treated with expensive drugs, so your first visit should be to your gynecology department in your local clinic. Make an appointment with a doctor, take tests, donate blood, and then control in private clinics if necessary. They take the research to state laboratories where all these possibilities are available. If found, you can confirm all this with repeated tests. Even if you have your own money, I would not recommend immediately rushing to private laboratories or private clinics. I would never do this myself. We understand that inflammatory processes can occur, not only when exposed to pathogenic microflora, pathogens including viruses and bacteria. Plenty of research confirm the bacteriostatic action of our Actividan itself. It prevents penetration into cells by stabilizing membranes, essentially blocking receptors with which the viruses or bacteria can damage the cell, thereby protecting the cells and preventing the penetration of viruses, for example, inside the cell. Further, by using the viruses themselves, our Actividan blocks division. However, there are other points as well. We have different antibiotics with different effects, however. Actividan has components combating pathogenic microflora. In addition, it also has an immunomodulatory effect wherever inflammatory processes have arisen. As an immunomodulator, it controls our immune cells, leading these cells from the vessel walls, from the cavity of the vessel to the focus of infection, causing the inflammatory process. Plus, Actividan itself will still regulate processes of humoral immunity. These are the cells of the tissues where the inflammatory process occurs. Not just immunocompetent cells, cells of many tissues are capable of producing these factors of cellular immunity, which we call humoral. These factors include cellular immunity, which we term as humoral immunity. Their purpose is primarily to limit inflammation. This involves cells that produce immunoglobulins, which are of different types. One type of immunoglobulin essentially induces inflammation. Another type restricts the spread of inflammation to healthy tissues. In this context, we engage cellular humoral immunity again to limit inflammation sources, quickly eliminate pathogenic microflora, and maintain tissue health by limiting the inflammation process, thereby preventing damage to healthy cells. It is clear that the anti-tumor effect we discussed involves controlling apoptosis and rapid recovery, primarily restoring hormonal levels, which could be the first. Tumor changes in female reproductive organs can be triggered by many influences that we are discussing first and foremost. You understand that maintaining the hormonal flow, which will limit inflammation and proper regeneration, are all key aspects of our health. The most important thing is the correct influence of the endocrine system on maintaining health. Without our female hormones, we are concerned not only with skin health and the cardiovascular system health, but also with menopause, which is real for men too. In men, it is when their sex hormone levels change, and health depends on this. Men also age, and our skin does too. Why do you think men die earlier and have more heart attacks than women? This correlation is also connected with hormonal levels and cardiac muscle changes and so on. There are many aspects, a multitude of elements in the health of our reproductive system. This will practically allow our women, even at 65 to 70 years old, to appear younger than their age, desire to live, behave appropriately within the family and naturally. Even at 70 years old, a woman can have a strong libido, a woman can derive pleasure from sexual intercourse, and naturally maintain the health of her own man. Because if a man's sperm production doesn't work, neither does the prostate, then it's clear that the same thing will be an aging disorder. And if there is no sexual intercourse, why execute sperm? The sperm will die and be resorbed, and there is a change in their organs. Therefore, we are aging ourselves. So I always say you should never give up the pleasures of youth. With age, some women only begin to understand what intimacy with their sexual partner is, which brings complete satisfaction. You understand that sexual arousal, including in women, depends on blood flow and the normal functioning of the circulatory system. There are vascular disorders, especially in smokers. As age increases, libido disappears. We continue to smoke, but there is no more. This is referred to as the reproductive vitamin. Fat-soluble vitamins for women contribute to your youth, beauty, and health. No matter how much Actividan you take, you understand that without these vitamins, minerals, proteins, fats, and carbohydrates, that is, proper nutrition, understand that the tone of your muscles and skin primarily depends on your muscular system. When your body is firm, when your skin fits your muscles, naturally it will be tightened. There will be no sagging, there will be fewer wrinkles. What ages us the most is not just the face, it's our hands, our chest area. Many women notice as they age the chest area and the bra you put on. The whole chest is covered in wrinkles, the neck is covered in wrinkles, the arms, everything is in wrinkles. Basically, you understand that if you work on your muscles, muscle tone holds this health, that is the movement of life. So for exercise more, stress out your muscular system. This will improve the drainage of almost all tissues. The lymphatic system depends on the work of the muscles. This will keep the blood supply in normal condition and naturally prolong your youth, beauty, and health. Breathe fresh air because oxygenation is the main source. All biochemical reactions, including energy production for cell recovery, are impossible without energy. Our Actividan also serves as an energy drink. It enters the bloodstream and goes into the mitochondria, providing us quick energy by which regeneration, recovery occurs. If you drink enough water, you understand that many cells in our body, including blood properties, blood viscosity, this is enough water supply to our body. Some cells are 97% water. If there is not enough water, you understand this is one aspect of our health. Without our Actividan maintaining health, the body begins to age anyway. As we age, we understand, yes, that life expectancy increases, but overall we are measured by genetics. I told you that someone counts 250, someone counts 450. This is in complete normal health. Practically, we now see our own Years, it's like being 7 years old. If we were supposed to live up to 400 years, we are ruining ourselves, preventing any disease, maintaining the normal functioning of all organ systems with proper nutrition, lifestyle, normal movement, sufficient amount of fluids, breathing fresh air will preserve your beauty, youth, and health for many, many years, and you will always be in demand as a woman. You will be in demand in your own family, attract the attention of other men. Your husband will be happy to note that a woman of 70 years old attracts even younger men. So, woman, take care of your health, eat our Actividan. Now, I will answer Farida's question. I saw one question today, at least regarding a 38-year-old. There are no endocrine tests, no rounds, which means you didn't write what examinations the 38-year-old woman underwent. What is the diagnosis for infertility? It might be related to what I said earlier, the formation of a certain period, maybe the obliteration of the fallopian tubes, which the woman herself does not know about. That is, a hysterosalpingography must be done, and so on. That is, a full examination must be conducted in order to establish the cause. But no matter what, you understand, yes, first of all, you need to find out the reason. If everything is normal, the endometrial thickness in the uterus is normal. Normal patency of the fallopian tubes, ovulation is proceeding normally, that is, the egg is maturing. A partner has been tested who has a sufficient number of motile sperm capable of fertilizing. If there is an egg, there can be various reasons for the lack of pregnancy, including if the partner is not tested, then now it is obligatory to check two partners. I have a sister. She was tortured and treated for 10 years, almost cured to the point that she had no children at all. It turns out that the husband was to blame. No one examined the husband. When the husband was examined in Moscow, the poor fellow started drinking, had to separate, married someone else, immediately became pregnant, gave birth to two children. You see how it happens in life, but here doctors treat, 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 treat. They don't know what they are treating for. That is, if the cause is not established for the absence of pregnancy when examining both partners, then, as they say, this reason may be in hormones, which can be in excess or deficiency at one or another phase of the menstrual cycle. That is, everything needs to be taken there, and hormones should be taken and examined. Definitely after that, choose the dosage of our Actividan. If you are fully examined, please send the results of the examination and a diagnosis that, at least because she's thin, well, there are no endocrine diseases, there were no abortions, this doesn't mean anything. There was one pregnancy that ended in a miscarriage. That is, this means nothing. Write down the symptoms, but there's no diagnosis. I say again, a diagnosis must be established as to why pregnancy does not occur. Then either it will be 2 sachets or it will be 4 for what period of time. We have women who have already been given up, who for several months they took Actividan in an adequate dosage from 2 to 4 sachets, depending on what was there, what the diagnosis was. They became pregnant and gave birth to absolutely healthy children. You know this very well. We have a lot of reviews on these posted in the company, very many results. So naturally you understand that there are reviews here and there are test results.